The member for Dartmouth North.
Mr. Speaker, my question is for the Premier. The backlog in surgeries in this province is colossal and growing, and the health system and staff are over capacity and overwhelmed. Mandy Grant had surgery at Halifax Infirmary last week. She was placed in a cubicle and exposed to a janitor. Her pain medication was forgotten on 3 different occasions. And when the pain got so bad she began to get sick, a nurse gave her towels so she could clean herself up, and I can table that. Mr. Speaker, the health plan repeats a lot of what we've already heard. So what relief is the Premier offering to the hundreds of staff and patients trying to give and receive health care in these conditions right now?
The Honourable Minister of Health and Wellness.
Thank you to the member for the question. So we're very concerned with the report in the paper today, and of course we really encourage that person to reach out to the Nova Scotia Health Authority and talk directly with them about her experience. We are investing heavily in healthcare. The Action for Healthcare plan is a roadmap for us to move forward. We've been very clear about our approach. We are speaking with healthcare workers on a regular basis. We are working in a cross-system approach with Department of Health as well as Nova Scotia Health to address these ongoing concerns. We know this is not new. This is a system under strain, and we will continue to work alongside healthcare workers in order to address the concerns that they have and fix the system.
The member for Dartmouth North under first supplementary.
Mr. Speaker, most people waiting won't actually get into a hospital anytime soon. We've just learned that only emergency and urgent surgeries will take place in Kentville and Bridgewater. This means even more people will wait in pain. On top of that, acute care bed capacity is at 106%, and the emergency department at Soldiers Memorial will be closed for the next 2 weeks so that staff can be redeployed to the Valley Regional. Mr. Speaker, people are very concerned about their ability to access care of any kind in Nova Scotia right now. Can the Premier see that the much-anticipated health plan is empty of anything that would provide comfort to these people right now?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. I don't feel it's empty at all. I feel that plan is built on the voices of healthcare workers in this province. We traveled around and we spoke to them directly, which is something that no other government in this province's history has done. I appreciate that there's a crisis. It's been there for a long time. I've felt it. That's why I'm sitting in this chair, to try and make a difference and to try and make it better. But I don't want to hear from anybody that we don't understand. We've invested over $5 billion in healthcare, and we will continue to invest and work alongside healthcare workers to address a system that hasn't been looked after in a number of years.